Rhinoplasty is perhaps the most challenging of all plastic surgery procedures. Dr. Vikas Gawri, plastic and cosmetic surgeon at Kyra Aesthetic Clinic, Ludhiana, is an authority in rhinoplasty.
In this video, Dr. Vikas Gawri speaks about post-operative instructions after rhinoplasty surgery.
So post-op instructions after rhinoplasty. So immediately after the surgery, you will be awake and resting in a recovery room. Most of the patients, they fear for the pain, but the pain after rhinoplasty is of the mild degree that is easily relieved by the painkillers for next 5 to 7 days. You have to breathe with your mouth open immediately after the surgery because your nose will be packed. So your nose will be closed for next 1 to 2 days. So you can breathe from your mouth. So your mouth will keep on drying, so you can take liquids at regular intervals. When you lie down, you can lie down with the 2 pillows under your head, so your head is elevated. That will prevent the swelling. Second thing is the cold compresses. So you don't use your ice directly over the cheeks, but you have to use a cloth dipped in the ice water, then you wrung it, then you apply for the cold compresses to avoid swelling. This is important for first 2 to 3 days only. Afterwards, you don't need any cold compresses. You don't need to keep it elevated. The next precaution is about the diet. After the rhinoplasty, we advise the semi-solid diet, which does not require excessive chewing for 1 week. Your upper lip may be numb for few days. When you can brush your teeth, so be gentle while brushing, use the soft brush, and you can do the mouthwash also. The next precaution is how to blow your nose. So we advise to avoid blowing. So you don't have to blow outside. You can breathe inside, but avoid blowing off your nose. If you get a sneeze, then it is better to sneeze with the mouth open. The next precaution is the saline spray. So we will give you a small bottle with the normal saline. So you have to push or pump the normal saline with the spray, so to keep the inside of your nostrils wet and moist. You can do it 3 to 4 times on both the nostrils. You can apply the normal saline, so that will keep the proper healing of the scars inside. So in the rhinoplasty, there is a very small cut which is visible on this part of the nose. This is called columella. Then the bigger cut is inside the nose, that is not visible. So we lift whole of the skin and we work on the underlying cartilage and the bone. We carve it nicely and put the skin back. So there are stitches inside the nose. So normal saline spray is to keep the stitches inside the nose as wet, and the healing will be better. Then the next point is the NESPORIN ointment or the Vaseline ointment. So you have to take a earbud with a cotton bud. So you have to take some ointment and apply it inside your nose. Next is the prescription. So prescription is for the tablet AUGMENTIN, that is an antibiotic for 3 times a day with breakfast, lunch, dinner for next 5 days. And the painkiller, we usually advise a mild painkiller, that is a Combiflame, to be taken 3 times a day with breakfast, lunch, dinner for next 5 to 7 days. And other prescription parts are the optional. You can use some multivitamins or vitamin C, 500 milligram for proper healing for 2 weeks before and 2 weeks after the surgery. And you can be advised for the arnica ointment or the drops to avoid any bruising. Sometimes if we do extensive rhinoplasty, there are chances of bruising. Next is the follow-up visits. So there are 2 follow-up visits which are required. First follow-up visit is after 2 days for the nasal pack removal. Then after the pack removal, you can start breathing from your nose. and second follow-up is on the 7th day for the skin suture removal. Sometimes we call the patient for a third follow-up, that is on 10th to 14th day for the nasal splint removal. The routine activities at home, suppose you want to move around the home, you want to talk on a mobile, you want to watch a movie, do internet, you can do it from the next day only. But if you want to go out of the house for a walk, we usually advise it after 2 days. For jogging or running, we advise after 2 weeks. For gymming, exercise after 4 weeks. So all these instructions are given on our website, that is kyraclinic.com. So you open the page, under procedures you go under rhinoplasty, and there are pre and post instructions. All these instructions are written. If I missed any of the instructions, or you can call us on the required numbers. Even there are some cases which something unforeseen happens. Sometimes the patient wants to call to the clinic, so you will be given our contact numbers to call us. Thank you.
Kyra Aesthetic Clinic has gained a name in North India for its best services in all cosmetic surgeries.